My study is about the fracture risk after the use of advanced prostate cancer therapy. And it is a population-based study design to include more broadly represent the patient in the population because we know in clinical trials, the eligibility is quite strict. So a lot of patients who are older or with comorbidity are not included. The study design is a population-based study, so we included all the patients resided in a well-defined geographic area, and so we linked with the cancer registry in the U.S., which cover almost about 1/3 of U.S. population in the registry. We found that the cumulative risk of fracture actually increased over time and substantially actually exceed 20% after a few years, I think after 5 years. So the risk is substantial. And also we found there's some difference between racial group and also comorbidity may play a role in the risk of fracture as well. I think the significance is the absolute risk of fracture we found is substantially higher than what's reported in a clinical trial, which I think is more than double what's reported. And I think there are several reasons for that is the clinical trial usually are younger, relatively healthier, and also they have a shorter duration of follow-up. And I think it's important for patients to really understand the potential risk associated fracture in a doctor so we can have a mitigating strategy to reduce the potential impact associated with fracture. I think the bone health agent definitely has been recommended by the guidelines, and I think in our study we found that only less than half of the patient have documented the bone health agent use, and so I think further research to understand how we can really mitigate the potential risk will be important.